What types of HIV testing are available? When it comes to understanding HIV testing, it's important to know that there are several types available, each with its own purpose and method. Let's break them down. First, we have antibody tests. These tests look for antibodies that your immune system produces when it detects HIV. You can take these tests using either blood or oral fluid. Rapid HIV tests, including the only FDA-approved self-test, fall into this category. Blood tests taken from a vein can identify HIV sooner than those that use fingerstick blood or oral fluid. Next, we have antigen antibody tests, also known as combination tests. These tests can detect both HIV antibodies and a specific HIV antigen called P24. This antigen appears early in the infection, even before antibodies develop. These tests are often used in labs but can also be rapid tests using fingerstick blood. They are particularly useful because they improve early detection compared to tests that only look for antibodies. Then there are nucleic acid tests, or NATs. These tests detect the actual presence of the HIV virus in your blood. They can identify an HIV infection earlier than antibody or antigen antibody tests. NATs requiring a blood draw from a vein and are typically used for individuals who have had recent high-risk exposure or are showing early symptoms of HIV. They can also measure the amount of virus in the blood, known as viral load. Conventional laboratory tests involve blood samples drawn by a healthcare provider and tested in a lab. Depending on the type of test and lab processing times, results can take anywhere from less than an hour to several days. Rapid tests are another option. These can use whole blood from a finger prick, plasma, or oral fluid and provide results in about 10 to 20 minutes. They are especially useful in clinics, outreach settings, or even at home for self-testing. However, a positive rapid test result must be confirmed with a more specific laboratory test. Self-testing and home testing options are also available. There is an FDA-approved rapid oral fluid self-test that gives results in about 20 minutes. Another home test involves collecting a finger prick blood sample on a card that you mail to a lab, with results available by phone in a few days. Self-testing can help people who may face barriers to in-person testing. Urine tests are less commonly used but can also be collected and tested in a lab, with results taking several days. According to current guidelines from the Centers for Disease Control and Prevention, the recommended testing algorithm starts with an antigen-antibody combination test for initial screening. If the results are unclear, a nucleic acid test is performed to confirm the diagnosis. This approach improves accuracy and speeds up diagnosis. In summary, there are various HIV testing options, from laboratory blood tests to rapid point-of-care and self-tests. Each type has specific advantages related to timing, convenience, and setting. The right test for you will depend on your individual circumstances and access to healthcare services. Always consult a healthcare provider to determine the most appropriate testing method for your situation.